County leaders from across Colorado are blasting the state, saying state systems are failing our Colorado kids who need mental health services.
In a letter to state officials, human service directors say caseworkers have had to sleep in office buildings with children because there's no place for them to stay. Well, Denver 7's Adi Guajardo today talked with one advocate who says Colorado is in dire need of more resources.
The stories of foster kids in crisis are disturbing and gut-wrenching.
On February 3rd, 2021, she attempted to strangle herself while at school with a computer cord.
The Weld County director of the Department of Human Services described a 15-year-old in county custody who attempted suicide more than once. We're seeing stories like this pop up across the state at an alarming rate.
We have children and youth who have attempted suicide a dozen times, who cannot stabilize.
Lexi Kuznick, the associate director of the Colorado Human Services Directors Association, a nonprofit, penned a letter to lawmakers and the governor outlining a youth crisis. It reads, Colorado's system to serve our highest acuity children is failing.
The psychiatric bed shortage crisis right now is very bad. We do not have enough beds or enough facilities willing to accept these kids.
Staff hired to help foster kids experiencing breakdowns are also stretched thin.
We have child welfare workers who are staying with kids in hotel rooms while we're waiting to try to find a bed somewhere in Colorado or even somewhere else in the country. That's how much of a shortage we have right now.
Leaving kids in limbo.
As I understand it, we are about 500 to 600 beds short in the state to address the need.
Jenny Pingino, an advocate for investing in mental health, is hopeful the task force can help provide youth with adequate care.
In large part because of COVID, we find ourselves in an urgent situation that we would have never been able to see.
What's the solution? How do you solve this crisis?
Actually, by putting more money into the system to create more beds for these youth. That also means we need to put more money into the workforce. We think we need more resources, we need more energy and more urgency to this issue.
The state plans to use stimulus funds to add between 15 and 20 crisis beds by November, but advocates say it's not enough. In May, Children's Hospital Colorado declared a state of emergency for youth mental health. Advocates hope their partnership with the state can help create change in a system falling short.
I think everyone's taking this issue seriously.
Adi Guajardo, Denver 7.
And digging deeper into the issues surrounding mental health care for Colorado children, a class action lawsuit has been filed against the state, arguing Colorado has failed to provide mental health care for children in need. The lawsuit so far includes 3 plaintiffs. All 3 are teens who say they for months or years were admitted to the hospital but were then refused residential treatment because no beds were available. The lawsuit is similar to one previously filed in Illinois. That case resulted in a settlement requiring Illinois to revamp its mental health system for children.